Let's talk about back pain, not the I slept wrong kind. I'm talking about the chronic kind, the kind that lingers, that messes with your sleep, that slowly chips away at your energy, your mood, your focus, the kind that makes you wonder if this is how life is going to be from now on. You've probably been told to stretch, strengthen your core, ice, heat it, maybe even do a scan, take pills, injections, or even surgery. But here is the problem. Most of what you've been told about chronic back pain is incomplete at best and flat out wrong at worst. Hi, my name is Armando Cruz, and for the past 20 years, I've been helping high performers just like you eliminate pain and optimize health. Today, I'm breaking down 9 things you probably haven't heard about chronic back pain and why knowing them can change everything. Number 1, pain is not the problem. Pain is like an alarm system. Your body's way of saying, hey, something is off. But just like a smoke alarm won't tell you where the fire is, your back pain isn't always coming from your back. Number 2, you can have damage without pain and pain without damage. I know this is kind of mind-blowing. You've probably seen people with scary MRIs who feel fine, or people with clean scans who are in agony. Pain and injury are related, but they're not the same. Studies have shown disc bulges and degenerations are common even in pain-free people. My client, Jeff, is a perfect example. He had back pain. He went to physical therapy for months with no improvement. His imaging was clear. There was no herniations, no fractures, no strains, yet he still had pain. When he came to us, gratefully, we were able to eliminate that pain because we were aware of number 5. So stick around so you can see how we got rid of him when we get to number 5. Number 3, chronic pain changes your brain. We've all been there when you're exhausted. Then you become more hypersensitive to everything, really. Someone says or does something that would normally not bother you, and then just like that, it sets you off. Pain does the same exact thing with your nervous system. When pain becomes chronic, your nervous system gets hypersensitive. Your brain starts to expect pain, and even when tissues are fine, when pain becomes chronic, your nervous system gets hypersensitive. Your brain starts to expect pain even when the tissue is fine. This is called central sensitization. It's like your body's alarm system is stuck in the on position. Number 4, emotions matter. Stress, anger, fear, guilt, they all show up in the body. I've worked with men who carry stress right on their back, like if they're carrying a backpack full of bricks. If you're only treating the physical pain, you're missing a huge part of the picture. If you don't help the person emotionally take off that backpack of bricks weighing them down, the pain will persist. Number 5, where it hurts is rarely where it starts. Remember our guy, Jeff, with the back pain and the clean imaging that we spoke about in number 2? Well, he was having back pain. His previous therapy was focused on his back. We went deeper. Here's the inside scoop. We found out that he had stubbed his toe a month prior. This set off a series of chain reactions in his body. So let me walk you through them. He started walking funny, which now shifted him to one side and now threw off his hips. His hips were off, so now it threw off all the tension and now it turned off the stability and the firing around the hips. Once we restored his toe mobility, his hip alignment, we were able to access his body's ability to activate and stabilize again. Now he was walking and moving properly. Now he had no more pain. Your body is one connected system. Treating only the site of pain is like chasing a rainbow. You ain't never gonna get it. Number 6, movement isn't always medicine. Yes, movement helps. In fact, movement I love for most things, but only if it's the right kind, at the right time. Pushing your body through pain, doing random stretches or copying someone else's rehab plan can often make things worse. You need movement that matches your body's needs and the proper patterns. Remember, what gets fired together gets wired together. Number 7, breathing is underrated. You breathe about 20,000 times a day, but most people, they breathe shallow and fast and from their chest, not their diaphragm. That keeps your nervous system in that fight or flight mode and limits your core to stabilize, and it also brings up anxiety. Remember, breathing better equals better healing. When people are malnourished, think about this, they don't heal quick. They get sick easy. And so improper breathing is a form of oxygen malnourishment. Your brain and tissues need the oxygen to heal, repair, and grow. Number 8, most back pain treatment plans ignore your story. You're not a textbook, yet most programs are a one-size-fits-all. They don't ask critical questions. What caused the pain? What else is going on in your life? What are you carrying physically, emotionally, mentally that's keeping you stuck? I think one of the biggest compliments that I get is when one of our clients finishes doing an assessment and they say, wow, this is the most thorough assessment I've ever done. No one's ever asked me these kinds of questions. I love that they feel that way, but I'm also saddened that no one has asked about their story. As humans, we are forged by our stories. Doesn't it make sense that a medical provider or medical professional should be asking you about your story? Because your story shaped who you are, and it's gonna shape your nervous system and your body. Number 9, pain can be your teacher. Yes, it's frustrating, exhausting, infuriating, but pain is your body's way of getting your attention. It's asking for change. It's asking for safety. When you stop fighting it and start listening to it, that's when things begin to shift. So what do you do with all of this? Start by getting curious. Listen to your body, not just your symptoms. Understand your patterns. And if you need help, don't settle for generic advice. Find someone who can guide you through the complexity, not just mask your pain. Listen, if you're a high performer who's tired of being held back by chronic pain, I help you understand, eliminate, and prevent it for good. Ready to get clear? Visit cruisecountry.com and schedule your pain profile analysis, because you weren't meant to live in pain. You were built to move, to lead, and to live fully. So if you haven't done so, go to cruisecountry.com, schedule your pain profile analysis. And if you haven't done so, hit the like and subscribe button and check out these videos up in here. I'll catch you later.